Hi, I am Dr. Jiten Chaudhary. I am a surgeon by profession. My area of expertise is painless correction of the anorectal problems. Today I am going to talk to you about the very prevalent conditions like fissure and piles, and that too non-surgical or medical management of the both these diseases. But before coming to the treatment part, I want to make you understand the fissure or piles are basically caused by constipation. Anything which will cure the constipation will cure both these diseases, especially if they are not acute. If they are acute, the fissure can still be created with the medicines, with the help of some analgesics, some creams, and with the help of some laxatives. So before any treatment, we have to correct the constipation, because that is the culprit which causes both the diseases. Now, constipation can be treated by some natural ways, such as drinking lots of water, and especially if you take hot water in the morning, that too almost a liter of it, it will relieve the constipation very effectively. Apart from having the more water, we have to increase roughage in the diet. That roughage you can get it from the vegetables, you can get it in the form of the various salads, and also there are over the counter available preparations like isabgol, or there are various fibers available on over the counter, which you can take it from the pharmacist, or your doctor can prescribe, which will help you get relief of the constipation. And in addition to that, you have to avoid tea, coffee and alcohol. See, tea, coffee and alcohol contains diuretic. Once I say diuretic, means it causes more of formation of urine. So whatever water you drink goes more in the form of urine, and less is left for your intestines, so ultimately leading to constipation. Now these are the natural ways. Apart from the dietary thing, one has to exercise also regularly. What we say in our language is, if you don't move, your bowel is also not going to move. So make it a point, you should exercise, at least try to walk for some kilometers in a day, so that your bowel also moves. Apart from the medicine, apart from the constipation treatment, there are certain over the counter drugs which are available, like there are some muscle relaxants which basically act on the smooth muscles, like diltiazem and nitroglycerin. Your doctor will prescribe those medicines and you can apply locally there. What these medicines basically do is basically relaxes the smooth muscles of that area, which we as a doctor call it as a sphincter. So whenever you go to pass your stools, that area, instead of getting contracted, relaxes. See, this relaxation is very, very important, because unless until you get the relaxation, every act of defecation, every act of whenever you go to pass your stools will cause injury to that area, and you will suffer from pain and bleeding. To avoid that, you have to apply that cream, and especially before going to the stools. So after applying the cream, try to wait for 2 to 3 minutes, so that the effect of the cream is already there, that the drug is taken up there, the sphincter relaxes, and then you pass it with some comfort. So this is very important. Then another thing which is very important is sitting in a tub of hot water. See, hot water does three things. It basically increases the blood flow in that area. It cleans that area and removes the toxins also. In our language, we call it as a sitz bath. These are the three pillars of treatment. One is basically making the stool soft using laxatives or some natural means. The other is sitting in a tub of hot water, and the third is applying a local muscle relaxing creams like nitroglycerin and diltiazem. But we have to understand, when the fissure is fresh or it is acute, these things can help to cure the fissure completely, but you have to have patience and take the treatment for at least 20 to 30 days to have the full effect. But if you don't do that, your fissure is going to become chronic, and once it becomes chronic, then you have to go for the surgery. Now coming to the piles or hemorrhoids, what we call in our medical language, or in the common language we call as a mulvyad or bawasir, can be treated by medical management, especially once it is only on the first or second degree of stage. In our literature, we divide hemorrhoids into 4 grades. but it is out of the scope of this video to tell the various grades. Only thing is you have to understand that when it is in the initial stages, it can still be managed by avoiding the constipation. So the major thing is you have to avoid constipation by anyhow. But what I want to convey more than the treatment part is that don't be afraid of anything, don't have any social taboo, don't have any shyness among yourselves, because there are so many various conditions which can present similarly like fissure or piles, but they can be of very sinister gravity, like not to tell you about, it can be like a cancer, it can be ulcerative colitis or Crohn's disease, and if you delay in the treatment, you will have a very bad outcome of the disease. So the main thing is you have to come to me or to some other doctor which is near you and show him and get evaluated and examined at least. For more information, you can contact me on Librate.